Many people believe that memory loss is simply a normal part of getting older, but in reality, it can sometimes be an early warning sign of a serious neurological condition known as Alzheimer's disease. This disease is one of the most common causes of dementia in older adults and affects millions of families around the world. It gradually damages the brain and interferes with memory, thinking, and behavior. Because the disease develops slowly and its early symptoms can appear mild, many people overlook the warning signs until the condition has already progressed. Understanding how Alzheimer's disease works, what symptoms to watch for, and how it develops over time is important for early recognition and proper medical care. What Alzheimer's disease actually does to the brain. Alzheimer's disease is a progressive neurological disorder that causes brain cells to lose function and eventually die. The brain relies on billions of neurons communicating with each other through complex chemical and electrical signals. In Alzheimer's disease, abnormal proteins begin to accumulate in the brain. One of these proteins forms structures known as amyloid plaques, which build up between brain cells. Another protein forms tangles inside neurons, disrupting their internal transport systems. Over time, these abnormalities damage and destroy nerve cells, preventing them from communicating properly. As more neurons are lost, certain areas of the brain begin to shrink, especially the regions responsible for memory, learning, and reasoning. This gradual damage explains why the symptoms often begin with memory problems and slowly expand to affect many aspects of daily life. How common the disease is today. Alzheimer's disease is currently the most common cause of dementia worldwide. In the United States alone, millions of older adults are living with the condition, and the number continues to rise as the population ages. Most people who develop Alzheimer's are over the age of 65, although a smaller number may develop early onset forms of the disease in their 40s or 50s. Because life expectancy has increased in many countries, doctors and researchers expect the number of cases to grow significantly in the coming decades. This growing prevalence has made Alzheimer's disease a major public health concern and an important focus of medical research.
Early warning signs that often appear first. One of the earliest and most noticeable symptoms of Alzheimer's disease is short-term memory loss. A person may forget conversations that happened recently or repeatedly ask the same question because they cannot remember the answer. They might misplace everyday objects, such as keys, phones, or glasses, and have difficulty retracing their steps to find them. At first, these memory lapses may appear minor, but over time they occur more frequently and begin to interfere with daily life. Another early sign involves difficulty completing familiar tasks. Activities that were once routine, such as preparing a meal, managing finances, or operating household appliances, may suddenly become confusing or frustrating. Individuals may take much longer to complete simple tasks or may avoid them altogether because they feel overwhelmed. Changes in thinking and orientation. As Alzheimer's disease progresses, many people begin to experience confusion about time and place. Someone may forget what day it is, lose track of the season, or struggle to understand how much time has passed. In some cases, individuals may become disoriented even in places they have visited many times before. They might become lost while walking or driving in familiar neighborhoods. These changes occur because the parts of the brain responsible for spatial awareness and memory are gradually damaged. Difficulty with language may also develop. A person may pause during a conversation because they cannot remember a common word, or they may substitute unusual words for everyday objects. This can make communication challenging and may lead to frustration for both the individual and their family members. Changes in mood, personality, and behavior. Alzheimer's disease does not only affect memory and thinking, it can also influence emotions and personality. Many individuals begin to show noticeable changes in mood or behavior. Someone who was previously calm and patient may become easily irritated or anxious. Others may develop suspicion or distrust toward family members or caregivers, sometimes believing that others are stealing or hiding their belongings. Some individuals withdraw from hobbies, social gatherings, or activities they once enjoyed. This withdrawal can happen because the person feels embarrassed about memory problems or finds it increasingly difficult to follow conversations in activities. These emotional and behavioral changes are common in Alzheimer's disease and often place additional stress on families and caregivers.
How the disease progresses over time. Alzheimer's disease usually develops slowly and progresses through several stages. In the early stage, symptoms are mild and may not significantly interfere with daily independence. Individuals may still live alone, work, and participate in normal activities, although they may rely more on reminders or notes to manage tasks. During the middle stage, memory loss becomes more severe and confusion increases. People may forget important personal information, such as their address or phone number. They may need help choosing appropriate clothing, preparing meals, or remembering to take medication. Behavioral changes such as agitation, sleep disturbances, and wandering may also appear during this stage. In the late stage of the disease, brain damage becomes extensive. Individuals may lose the ability to communicate clearly, recognize loved ones, or perform basic physical tasks such as eating, walking, or swallowing. At this point, full-time care is usually required. Who is most at risk of developing the disease? Age remains the most significant risk factor for Alzheimer's disease. The likelihood of developing the condition increases significantly after the age of 65, and the risk continues to rise with advancing age. Genetics may also influence risk. People who have close relatives with Alzheimer's disease may have a higher chance of developing the condition themselves. Certain genetic variations have been associated with increased susceptibility, although having these genes does not guarantee that someone will develop the disease. In addition to age and genetics, several health conditions may increase the risk. Cardiovascular problems such as high blood pressure, diabetes, high cholesterol, and obesity have all been linked to a higher likelihood of developing Alzheimer's disease later in life. These conditions can damage blood vessels and reduce blood flow to the brain, which may contribute to cognitive decline. Lifestyle factors that may influence brain health. Researchers believe that lifestyle choices can play an important role in maintaining brain health and possibly reducing the risk of Alzheimer's disease. Regular physical activity is one of the most beneficial habits for the brain. Exercise improves circulation, supports heart health, and increases blood flow to the brain, which helps nourish brain cells. Mental stimulation is also important. Activities that challenge the brain, such as reading, learning new skills, solving puzzles, or engaging in complex discussions, may help strengthen connections between neurons. Diet may also influence cognitive health. A balanced diet rich in vegetables, fruits, whole grains, healthy fats, and fish provides nutrients that support brain function. Some studies suggest that dietary patterns similar to the Mediterranean diet may be associated with a lower risk of cognitive decline. How doctors diagnose the condition. Diagnosing Alzheimer's disease involves a careful evaluation of symptoms, medical history, and cognitive function. Doctors may perform memory tests and problem-solving assessments to measure thinking ability. They often ask questions about changes in behavior, daily functioning, and memory patterns. Brain imaging techniques such as MRI or CT scans may also be used to examine the structure of the brain and rule out other possible causes of cognitive problems. In some cases, specialized tests can detect biological markers associated with Alzheimer's disease. Although diagnosis can be complex, early evaluation is important because it allows patients and families to understand the condition and plan appropriate care. Treatment and supportive care. Currently, there is no cure that can completely stop or reverse Alzheimer's disease. However, several medications can help manage symptoms and temporarily improve cognitive function in some individuals. These treatments work by supporting communication between brain cells or by influencing certain brain chemicals involved in memory and learning. In addition to medication, supportive care plays a critical role in managing the disease. Establishing daily routines, maintaining a safe environment, and encouraging social engagement can help individuals maintain independence for as long as possible. Caregivers and family members often play a central role in providing emotional support and assistance with daily tasks. Why early recognition matters. Recognizing the early signs of Alzheimer's disease can make a significant difference in how the condition is managed. Early diagnosis allows individuals to seek medical advice, begin treatment sooner, and make important decisions about future care and lifestyle adjustments. It also gives families time to plan support systems and learn how to manage the challenges that may arise as the disease progresses. Although Alzheimer's disease remains a complex and difficult condition, ongoing research continues to improve our understanding of how it develops and how it might be treated or prevented in the future.